So today we'll be talking all about, can your vagina be too wet? Well, the short answer is yes. It's important to note that the vagina is a mucous membrane, which means that skin and tissues of the healthy vagina are always moist. Hormonal changes, arousal, and other factors can affect the wetness of the vagina. But hormonal swings, fertility status, arousal can change the amount, the consistency, and the color of a person's vaginal fluid. So, vaginal fluids are essential for keeping the vagina healthy and for making sexual activities comfortable. However, some people feel anxiety about these vaginal fluids, and knowing what they are, their function, and what is normal is what I'm going to tell you today to ease all your worries. So, first of all, what causes vaginal wetness? Most of which come from one of two places. One is the Bartholin glands and the other is the cervix. So the Bartholin glands are two small pea-sized glands located just inside the vagina. They help to lubricate the vagina to prevent excessive dryness. They also produce moisture, and when the female feels aroused during sexual activities, they produce more fluid. The cervix, on the other hand, produces mucus throughout the person's menstrual cycle. So as ovulation approaches, the cervix produces more fluid, and this fertile cervical mucus can help the sperm to travel to the egg, increases the odds of pregnancy. What are the components of this vaginal fluids? So whenever you see vaginal fluids, you are thinking about water, which is 90% of the fluid. There is also salt, which is about 1%, contains some sodium chloride, some calcium, some phosphate. There's also some organic compounds like amino acid, lipids, and glycogens. Some old cells, like the cells that lines the vagina, the uterus, and the cervix, they regularly slut off and leave the body through your vaginal fluid. And even antibodies. These vaginal fluid may contain these things that reduces the risk of some infections. And let's now talk about the most common causes of vaginal wetness. On average, the healthy female produces 1 to 4 milliliters of vaginal fluids in a day. And the amount of discharge that you produce changes day to day. As I said before, ovulation approaches, a person might notice more vaginal wetness since the cervix increases fluid production at this time. So you're having both the cervix and the glands producing, so you are more wet. As regards to arousal, with same, when a female feels sexually aroused, the Bartholin glands produces more fluid. This fluid helps to lubricate the vagina during sexual activity, decreasing the risk of painful friction and injuries. And some people notice that their vagina become more lubricated during sex even if they don't feel aroused. The lubrication typically lingers even after a person finishes having sex or no longer feel aroused. And this is normal for the vagina to feel wet up to 2 hours after sex or arousal. As regards to the hormonal impact of same, with the higher estrogen level, this increases your vaginal wetness. People on hormonal treatment, such as those taking hormone replacement therapy, may notice an increase in vaginal wetness, and some people who uses vaginal estrogen can have increase in the wetness of their vagina. So what can make your vagina too wet? The big I word is infections. So when vaginal fluid changes or a person produces significantly more vaginal fluid than normal, it may be a sign of infection. A yeast infection can cause a thick, white cottage cheese discharge, which may itch and burn or feel very sore and dry and can make sex very painful. It's a fungal infection, so antibiotics will not do anything for it. You need antifungal medication. Another thing that can cause excessive wetness is bacterial vaginosis. This is a bacterial imbalance of the vagina. Some persons may have no symptoms at all, but others might notice a little itching, a little burning, or they can produce a white, gray, or a yellow fluid that smells fishy. And this smell sometimes worsens after sex. Another thing that can cause excessive wetness is a sexually transmitted disease or infection called trichomoniasis. This may cause a yellowish or a greenish discharge, and sometimes the discharge look bubbly and may smell bad, especially after a menstrual period, and sometimes the vagina itches and burns. Lastly, something else that can cause vaginal wetness is when the Bartholin glands becomes obstructed and form painful cysts. So if you have a tender, painful swelling just inside the lips of the vagina, this may be a Bartholin gland cyst. Many can go away on their own, but if the cyst grows and get large and do not heal, your doctor has to drain it. So in a nutshell, vaginal wetness that causes no other symptoms is not usually a problem. Vaginal fluid is a sign of a healthy vagina and sign that the body is working well. What warrants you to go to the doctor is if you have vaginal dryness that lasted more than a few days, vaginal discharge that smells bad, itching, burning, or other vaginal pain, a change in your vaginal discharge after sex or with a new partner, swelling in your vagina, changes in the vaginal fluid associated with a new medication like if you're taking birth control or estrogen replacement therapy, or if you have unexplained vaginal pain or sensitivity. And that's it for this video. Don't forget to like, comment, share, and subscribe to Nikki at your service for lots more interesting content. See you soon. Bye.